Hello, my name is Maggie and I am a nurse practitioner student at the University of Vermont. I am very interested in supporting patients through end-of-life care and would love the opportunity to discuss Death with Dignity, or Act 39, here in Vermont with you. If you or a loved one is considering death with dignity, in this video we will discuss what Act 39 is, who is eligible, how to talk to your provider, and some resources you can use to research further. So Act 39 is also known as the Patient Choice and Control at End of Life Act, and it provides eligible Vermont residents with terminal diseases, a diagnosis of 6 months or fewer, the option to be prescribed a dose of medication that, if taken, will hasten the end of their life. It is important to note that this option requires the participation of 2 Vermont licensed physicians. Your nurse practitioner or other advanced practice provider can help connect you with willing physicians in your area. When talking to your healthcare team about what's important to you at the end of your life, you might want to discuss your religious preferences and your family customs or traditions. A great time to discuss end-of-life care goals is when you go over your advance directive or COLST form with your provider. If you wish to pursue death with dignity, I urge you to discuss this choice as early as possible. Know that it is okay to be direct with your request, and you should ask your physician a yes or no question regarding their willingness to help you utilize the Death with Dignity Act. If they are unable to help you utilize Act 39, then you will need to take the time to find a willing physician. Having conversations about end-of-life care goals may feel daunting or difficult. I truly hope you feel supported by your healthcare team. It is our job to help you understand your options at the end of life. So let's talk a little bit about eligibility. To be eligible to qualify for Death with Dignity, you must be a resident of Vermont. You must be 18 years or older, capable of making and communicating your healthcare decisions, and diagnosed with a terminal illness that will, within reasonable medical judgment, lead you to death within 6 months. And this diagnosis must be confirmed by 2 licensed Vermont physicians. You must also be able to self-administer and ingest the prescribed medication. All of these requirements must be met without exception and confirmed with 2 physicians in Vermont. So there is a process to being able to utilize Act 39, and it begins with your first oral request. So this can be made at any time while discussing your goals with your provider. Then there's a waiting period of 15 days, known as the first waiting period. After that 15 days, at any point in time, you may make your second oral request. And then you will pursue a written request, and you can find Vermont's written request form through the Vermont Department of Health. It is recommended that you submit your written request after the 2 physicians submit their respective paperwork too. And then there's a second waiting period, and your physician must wait at least 48 hours after receiving your written request to write your prescription. Once the prescription is delivered to the pharmacy, you may fill your prescription at any time, or you may not choose to fill it at all. Once the process is initiated, you should feel no pressure. Your healthcare team is simply providing you with this option, and you are free to utilize this option as you wish. There are 3 scenarios in which you may be unable to take the medication after it's prescribed. These scenarios entail: your disease progresses to coma or death, if you are experiencing severe and increased confusion and have lost the capacity to ask for the medication and be cognizant of what that medication is, and if you are unable to swallow the 4 ounces of liquid that the medication is dissolved in within 2 minutes or less. For more information, please go to www.deathwithdignity.org, and there's also Patient Choices Vermont.